Dr. Fox.
Hey Adam, how are you?
I am great. How about yourself, my friend?
Doing good, thank you.
So day one with the I Plus. Talk us through how long you've been in lasers. I know you got the Waterlase, the white-shelled Waterlase when?
Back in 2003.
And then you just got the I Plus now.
Right.
Today's day one.
Right.
So talk about what you use the Waterlase for, and then talk about some of the differences between where the technology's evolved to, and really why you decided to even get into laser dentistry.
Back in the 1990s, I started hearing about lasers, and I've always been about doing dentistry that's painless as possible for the patients. And nobody likes the drilling and the shots and all that. So I was always on the alert for something that would allow us to eliminate that. So when I started reading about lasers, I was especially interested in the Waterlase water laser because of the fact that you can do fillings and so forth without anesthesia, without shots and drilling. So I bought that in 2003, got a lot of training on it, and I've used it a lot. I've done children as young as 3 or 4 years old, fillings, and I've done even adults as old as 75, 80 years old. Most of the time it's teenagers and young children, but we've done it on all ages. And I've mostly used it for fillings and on these people, and I would say I've done probably about 3,000 fillings.
When I read that on your website, I was blown away.
Yeah, I use it a lot.
So 3,000 fillings. What would you
Right.
change? I mean, if there's a reason why you evolved to the I Plus, beyond the fact that we discontinued the laser, right? So
Right.
what made you say, okay, I want the I Plus because it does X?
I began even a year or two ago looking around a little bit to see if there was updated, improved versions of the laser. And I'd heard about the I Plus, and so recently when this laser started to seem a little obsolete, it was time to look into the I Plus. And I like the fact that it seems to cut faster. In fact, it did today. It cut a lot faster. I was able to do the preps faster.
What'd you do today?
I did something like 22 fillings, and we did 3 quadrants of deep scaling, root planing, periodontal therapy with some of the patients. And it went extremely well. Just thrilled with it. I like the fact that I can do the periodontal work as well as the fillings on the patients. And it definitely cut faster. I was able to do some pretty big fillings that I would not have attempted with the white-shelled older water.
Kevin's was pretty deep, right? That filling on 18?
Yeah, that to the lower left second molar, that was a big fill. I would not have attempted that with the other laser.
What about the onlay?
Yeah, I never would have even thought about doing it.
Because with Kevin, you built some confidence, and you said, all right, I'm doing it.
Right. See, the onlay, that was a lot of tooth structure removed, and the patient didn't even flinch, never even felt it. So that was pretty incredible. So I'm looking forward to, doing more things with it. And thrilled about the fact that some of the patients just said they felt nothing or very, very little. It's not always totally painless, but most people felt very little, if anything at all, and so it's pretty exciting.
Now, full disclosure, we did give 1 injection today.
We did for the very first patient who had really sensitive teeth. It doesn't work for every single patient. This lady had very, very sensitive teeth, so we just got her numb. And then we were able to finish up with the laser just fine. She felt nothing at that point.
We did everything from onlays, deep class 1s, incisal edges. I mean, we really hit the gambit today.
Exactly.
And we had quite a bit of extra time, too. We were able to, when you don't give injections, you get some extra time.
It saves a lot of time. You just sit down, you start working after you explain to the patient how the laser works. And the patients are so accepting of it, especially mothers. So many times I'll talk to them about their children having cavities, and they're a little bit upset, but I explain to them that it happens, not to worry. We do a laser now, so your children won't get a shot. They won't have the drill in their mouth, the drilling on the tooth. And it's a minimally invasive filling, so we're taking out the least amount of tooth structure and putting in a tooth-colored filling that's not going to fall out, and it's not going to re-decay or break down. So that makes the mothers pretty happy, and it's a win-win for everybody.
Dr. Fox, you did fantastically well today. I was thrilled watching you work today. I learned just as much as you did. And I tell you what, patients that happen to go to your practice in Burke, Virginia, are very lucky to have you. You're very progressive, and you absolutely care about your patients.
Thank you, Adam. I appreciate the compliments. Thanks so much.